Acute Gout Meds, the unexpected effectiveness of common anti-inflammatories. Imagine experiencing sudden, intense pain in your joint that makes even the slightest movement unbearable. That's what a gout attack feels like. But what's surprising is how well common anti-inflammatory medicines work to stop it in its tracks. These medications are not just ordinary pain relievers. They directly target the root cause of the inflammation caused by urate crystals in the joint. Non-steroidal anti-inflammatory drugs, or NSAIDs, are usually the first choice doctors recommend. They work by blocking enzymes called cyclooxygenases, which are involved in producing chemicals that cause pain and swelling. When taken early, NSAIDs like ibuprofen or indomethacin can significantly reduce pain within a day or two. They are surprisingly effective because they interrupt the inflammatory process triggered by the crystals, making the attack less severe and shorter. However, they can cause side effects such as stomach upset or kidney issues, especially if used long-term or in higher doses, so medical supervision is important. Another key medication is colchicine. It works differently from NSAIDs by interfering with the activity of neutrophils, which are immune cells that rush to the joint during a gout attack. Colchicine prevents these cells from migrating into the joint and releasing inflammatory substances. This action helps to calm the inflammation quickly. Although colchicine is very effective, it can cause gastrointestinal side effects like diarrhea or nausea, especially at higher doses. That's why doctors usually prescribe low-dose regimens, balancing effectiveness with safety. Corticosteroids are also used to tame the inflammation. They can be given as pills or injected directly into the affected joint. Corticosteroids suppress many parts of the immune response, making them very powerful in reducing swelling and pain. They are especially useful for patients who cannot tolerate NSAIDs or colchicine. Their rapid action helps bring relief within hours, making them a reliable option during severe attacks. What makes these medications so unexpectedly effective is their ability to quickly control the intense inflammation caused by urate crystal deposits. They don't just mask the pain, they target the inflammatory process itself. This is why they are considered the mainstay of acute gout management, supported by extensive clinical guidelines and research. It's important to start treatment as soon as symptoms appear, ideally within the first 24 hours, to prevent the attack from worsening. It's also crucial to remember that these medications treat the attack itself. Managing uric acid levels through long-term therapy is separate and aimed at preventing future attacks. Always consult a healthcare professional to choose the right medication and dosage for your specific situation. Every person's experience with gout can be different, and a tailored approach ensures the safest and most effective treatment. So, while these common anti-inflammatories may seem simple, their ability to rapidly and effectively reduce inflammation during a gout attack is truly remarkable, making them essential tools in managing this painful condition.